On this next slide, you will see two different windows. You can just click the space button for the first one, and then the second one will pop up after you click the space button again. So that way you don't get too confused. Box 1, the medical inmate exclusion policy. Federal medical law prohibits the payment of federal Medicaid matching of funds for the cost of any services provided to an inmate of a public institution, except when the individual is a patient of a medical institution. What this means is that the state or the government doesn't want to pay the government money. So instead of continuing health care for the inmate, they turn it off just because they don't want to have to pay for a state inmate or any inmate for that matter, because they're an inmate of a public institution. The only time their medical insurance gets turned back on is if they have to go to a hospital for some reason, or occasionally if they're only there for less than 30 days, their insurance will not be turned off due to the policy. But if they are there for more than 30 days and something serious happens to them or they need a specific medication, the jail is paying for it out of pocket. This policy has definitely created a huge strain on the jail's budgetary needs. And then the next picture, the inmate exclusion policy can affect the quality of care for inmates. With that being said, it can. Clinical standards for medical care in a jail is not the same as it is on the outside. Yes, they have doctors. Yes, they have dentists who come in, but it is not the same as being able to go to your doctor's office or go see an oral surgeon. Many of them just get their teeth pulled, or, for example, the other day, a guy had a toothache, and the dentist who was inside the jail only pulled out part of his tooth and left it in there, and then he ended up in pain with a huge infection, and they ended up having to send him out to an outside dentist because the inside dentist could not do the job. This greatly proves the gap in standards between medical care inside of a jail and medical care to regular people who are on the outside. Because they are low budget, it could determine whether or not they do a certain physical or have a certain dentist, or even just the type of medicine they're giving these guys, or who gets seen and when they get seen and how often they get seen. So many different things play into factor with this.